AI is pretty cool, kind of scary for some people. But talk to me about the ways that the hospital is using AI.
And we're able to use AI to aggregate that data and analyze it to hopefully predict something before it actually happens.
Yeah, it's really empowering, to help people kind of get some agency back in this process. It's relatively straightforward, simple technology that learns and improves over time.
Would you want AI to be your doctor? Or how about to help fight insurance for you? Or how about being in the room when you're with the doctor, listening in and flagging certain words for your doctor to see? That's the reality. We literally live in this world right now, and on today's show, we're going to dig into all the areas that AI is touching healthcare. Don't go anywhere.
Have questions about your healthcare and not sure where to turn? We give you unfiltered insight into how healthcare really works. This is Give It To Me Straight, Doc, presented by Tampa General Hospital and our partners at USF Health Morsani College of Medicine.
Welcome to Give It To Me Straight, Doc. I'm your host, Anjalee Khemlani. Today's show is all about AI, and I'm really excited to dig in because this is an interesting one. If you don't already know where AI is touching healthcare, today's show is going to make it very clear for you. And one of those areas is having an AI doctor, as well as having AI refill your prescriptions for you. Not a joke. That's reality. And to talk about it all, we have Doctronic co-CEOs, Dr. Adam Moskowitz and Matt Pavel. Adam, Matt, thank you so much for joining us today.
Thanks for having me.
So this is interesting. You guys started a platform a couple of years ago. You started working on this, and you introduced it to the world this year. Interestingly, at a time where we are now in a world talking about ChatGPT and Claude, and people are really familiar with AI. Do you feel like if you had introduced it a little bit earlier, you wouldn't really be getting the pickup that you are now?
Well, we launched the earliest product in September of 23.
That long ago.
Very basic. Yeah. And that long ago. And that was back when it actually was not clear that people wanted to talk to an AI about their health. And in fact, there were kind of rules that prevented companies that made LLMs from allowing people to talk with those AIs about their health. But we built the product just to see initially whether people would want to, expose that information and get that sort of help. It turns out that for sure people really wanted that. But we only really got to that next point where the AI can help doctors efficiently about a year ago. So in this past year, we've seen just this explosion where people want to use the AI and then they want to get all of that information that it gives you and take it to their doctors to get actual treatment.
And that's the people that know about it. So Adam, being someone who is in the medical field, I want to talk to you about this because your contemporaries. Doctors don't necessarily like AI edging in on their territory, right? It is not fun, and patients are using it nonstop. We've seen the numbers from ChatGPT. That's a reason why they launched a health program, because of the inbounds, millions of queries on their healthcare and hoping for answers that they're not getting from doctors. In a nutshell, Matt, this one's for you. Just tell me the 3 key things that Doctronic does for patients.
Sure. So Doctronic is an AI doctor with a primary care practice behind it. So anyone can talk to the AI for free and then talk to any doctor or our human doctors if you want. In the state of Utah, Doctronic is able to renew prescriptions for patients all by itself, doesn't need a human in the loop. And Doctronic is really reducing friction and increasing accessibility for people with chronic conditions.
You sort of nailed it at the beginning when you said that there's an access problem. Matt and I always talk about how, medicine has always had this math problem where supply will never meet demand. You're never going to have enough doctors to meet the needs of patients.
That's interesting. Never going to, because I know we talk about this all the time, the physician shortage. So there's no way to fill that gap.
No, I mean, if you think about it, think about how many times you yourself have not gone to see the doctor because it's too hard, right? Everybody sort of self-censors when they want to go see a physician or a provider because they just don't have access to them. And then the next thing you need to do is think about how often you would see a doctor if you had unfettered access. If you could snap your fingers and just have them sitting in front of you, we would never have enough doctors to do that. And so in a world like that, it's going to have to be technology that fills a gap.
As a patient, if I'm going to use this, how seriously should I take the responses from the AI platform if I'm using the AI doctor? I mean, should I just like take it for this is the diagnosis, or is it kind of a little bit, take it with a grain of salt, definitely go check it with an actual doctor, or, consult someone in the medical field with what you have?
Yeah, the intended use for our product in all 49 states except for Utah for one special case is for you to take it to your doctor. It's supposed to be a communication tool between you and your physician. And what you're really going to get out of it is not one answer, but possibilities, right? And they're going to be personalized. So instead of one diagnosis, you'll get 4 potential diagnoses, and they'll be listed in order. And when you get that, you are then supposed to go see a physician or provider to actually act upon that. What's different in Utah is that we now have a pilot program where you don't need to go see a doctor afterwards. You can actually get one specific use case acted upon by the AI, and that's for prescription renewals. In that particular case, the AI makes the decision whether or not it's safe to continue a medication or not. And in that particular use case, you do not need to go see a doctor.
So when we talk about the prescription part of it, that's interesting because I know, and I'm sure patients can relate to this, when you're trying to call in a refill and it's a simple refill, should be a simple refill, but you run into all the issues, right, of either your doctor needs to clear it or it just doesn't go through because of insurance. Does this take care of all of that?
So this...
Go ahead, Matt, sorry.
I was going to say, this doesn't take care of the insurance side.
Okay.
But this does take care of the case where you need a renewal and you just don't have any refills left, right? And you would have to call your doctor and you would have to kind of discuss the situation, and they would assess things, and then they would write you a renewal. So the AI can do that all by itself. And it also does that for $4. And so, much less than any copay would be, and certainly dramatically less than what it would cost if you were uninsured and had to pay for that out of pocket.
Okay, that's good to know. And then tell me about, and this is for either of you, when patients are using AI tools, what should, especially like yours, and this is more broader industry now, right? Doctronic aside, there are a lot of options out there. I know, Matt, you've mentioned that you use Claude yourself. So, there are a lot of tools out there. It feels scary to think about the use of AI, right? It's a world that we haven't necessarily delved into. It's new. How should we think about it? And can you tell us what it can't do yet? Like, I want to know the limitations, because just like we were, just sort of talking about not necessarily holding it at its word, you do need to take it to a doctor. Just what are the other limitations that we should think about right now broadly for AI in healthcare?
Maybe I can talk about a couple of the things that you should do, and then Adam, being a doctor, can talk about some of the limitations.
Good cop, bad cop. I love it. Do it.
Right. So, wait, does that mean I'm the good cop or the bad cop?
No, I think you're the good cop.
I'm the good cop. Okay, good. Just making sure. So listen, if you're talking to an AI about your health, then you need to make sure that whatever AI you're talking to is going to keep your data safe and private, secure, preferably HIPAA compliant, right, which Doctronic is. Doctronic is actually by default anonymous as well. And so if you don't make a user account, we don't even know who you are. You can upload documents, you can have a chat, it will do all of that for free, and then you can walk away. But if you are going to upload all of your documents, you also want to make sure that you're not dealing with an AI that's going to train on your data, which Doctronic does not do. It's not going to share your data, not going to go sell it to pharmaceutical companies, for example. So it's your data, and it's your health information, and you really have to keep that close.
Yeah. I think the areas where you should not use it, I mean, there's some obvious red lines. So this is not for an emergency or an urgent condition. This is for something where you do have the time to actually go that next step and see a provider, right? And we take pains to make sure that you don't do that. So there are within our system what we like to call guardians that ensure that users are not using it incorrectly. If it is potentially an emergency, the system will actually stop and say, this is not an appropriate use case for this. You should go call 911, go to your nearest emergency room.
Yeah, one of the important parts about seeing a provider after you talk to an AI about your health is that you need that availability. So there is ChatGPT Health now, which is great, but they don't have any way to actually connect you to a provider Doctronic has a primary care practice behind. We're available 24/7. We're licensed in all 50 states and DC. After you talk with our AI, if you want to talk to a doctor and your doctor isn't available, we can help you 24/7.
Just like any other telehealth option. So anyone could essentially take what you're giving them, just like they could take, an output from ChatGPT or the like, and take it to their doctor and just verify that. So
that's right, except that our AI is clinically accurate, unlike ChatGPT and most of the others. And, we can get into that if you want, but it's also much more convenient for our AI. It packages everything up nicely. It writes a doctor's note for you to take to the doctor.
Oh, that's nice.
So it really is meant to help you understand your health and then go get actual help from a real doctor, whether that's ours or yours. We don't care. It's free either way to talk to the AI.
So that helps kind of like write the information that your doctor needs to know in a clinical way, so that you're not walking through sort of the basic symptoms. It's already done that checking. So that cuts down the time. We know that time is notoriously a constraint for doctors these days. So that seems to be helping. Well, this is really useful information, guys. Thank you so much for joining us and sharing these insights. I'm sure, patients are going to be really excited to kind of utilize AI better and know how to use them better with your help. So thanks again, co-CEOs of Doctronic. We've got Dr. Adam Oskowitz and Matt Pavel.
Thank you so much.
Thank you.
Don't go anywhere. We've got more coming up on AI in healthcare. Welcome back to Give It To Me Straight, Doc. I am your host, Anjalee Khemlani. We've been talking on this show about AI and the many ways that that's new in healthcare. But let's talk about the ways that it's currently being used in healthcare, which you may not know about. And that includes imaging and radiology. That's like when you get a scan at the hospital. An AI agent could be reviewing that as well as your doctor. AI scribes, which we're going to get into in a minute, but it's basically AI listening in on your patient-doctor conversation. And then risk of readmission. That's one of the many ways, and there are a plethora of other ones that are included in this list that hospitals use to make sure that patients are safe, they stay safe, and they're not at risk of any kind of serious illnesses or contract anything in the hospital. And here to break it all down with me is Dr. Peter Chang, Senior Vice President and Chief Transformation Officer at Tampa General Hospital. Welcome, Pete.
Thanks for having me.
So AI is pretty cool, kind of scary for some people. But talk to me about the ways that the hospital is using AI. AI scribes in particular is kind of a new entrant, but it's being widely used. Talk to me about that.
Great. So with the advent of electronic medical records, it was great to exchange information back and forth. But to a patient, what does it actually mean when you talk about these AI scribes? We've shown that our doctors spend probably 4 to 6 hours after the last patient is seen, sometime during the middle of the night, to finish their notes and documentation for clinic visits. And there's actually a Journal of the American Medical Association article where a physician told the story about one of her patients, and the patient drew a picture as a pediatric patient. And when she looked at the picture, they published the paper in the article. And when you looked at it, it was a patient that drew the physician with his back turned to the patient. And that's how she interpreted that particular interaction. And so what that really says is AI scribes allow ambient listening to record the conversation between a physician and a patient and be able to queue up that note for a physician so the physician can actually spend more time with the patient.
And this is because we've gotten into a world where electronic health records kind of take over. You need to document everything as part of the conversation. You need to put in the medicines, all of that. Click, 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 right? There's a joke, count how many clicks in a visit.
Exactly.
So that's the reality that doctors are dealing with. And that's why patients feel ignored, or they feel like they don't have enough of the doctor's attention during a visit. And so this is supposed to kind of help break that down.
Correct.
Okay, so let's talk about some of the other ways that AI is being used. We know that there's also wearables. We're in a world where I'm wearing a smartwatch. Are you? Yes,
right.
You are.
Got it right
we
here.
all are, right? This is the new common thing. Wearables are also really popular. People wear rings to track their sleep and their moods and the like. So we've also got devices like beds that track your sleep. So we've got so many different ways of collecting healthcare data as an average person. How can you take that a step further, and how is the hospital taking that a step further?
Well, one of the programs we developed is called Hospital at Home. That allows us to bring inpatient care from the hospital actually out to a patient's home. And to do so, we need certain tools within the home, things like 24/7 remote patient monitoring, where we're capturing a ton of data that comes by every maybe 10 or 15 seconds. And we're able to use AI to aggregate that data and analyze it to hopefully predict something before it actually happens.
And how do you do this? Through the wearables?
Through the wearables. So it's
Okay.
a little patch that adheres to your chest, and we're able to get all of your vitals streamed to us wirelessly and securely, of course.
Can you just do that in the hospital? I mean, what's with all these beeping big machines? I don't get it.
Yes, we can. And we actually are doing some advanced work to do some of this type of monitoring within the walls of the hospital. So it's coming.
Okay. But it's just an expensive proposition. So slow.
Yeah, it's a little pricey. So as these things come out, they go through FDA approval, which is where the government says this is safe for patient use. And
Right.
that's a really expensive process. And unfortunately, that cost gets passed down to the hospital.
Okay. So time, slow. So ideally, if all goes well and you start implementing all these really cool devices, we can hopefully get rid of some of the sort of archaic technology, like, I don't know, paper forms every time I go to the hospital, or the fax machine.
Yeah, so we send and receive over 30 million faxes a year at TGH.
What?
We do. And so one thing we're using is having AI computer vision read the fax and digitize the information.
Well, that's helpful.
So instead of just scanning into the record where somebody then has to find the needle in the haystack,
I was going to say the stack looks like, yeah,
we're now
okay.
pulling that information out and surfacing it to our physicians and our clinicians.
That's really helpful. Okay, great. Because I know that there are some people who don't even know what a fax machine is today.
Yeah, unfortunately, yes. Yes.
I bet you can't wait to get rid of that.
Yeah, I can't wait. It's on my number one list. It's like most wanted, and it's a picture of a fax machine.
I kind of wish I could take out a bat here and just give it to you. Just like watch this live. Okay, no, but we can't do that. So instead, I will say thank you for joining us, Pete. Really appreciate the time and you breaking this all down for us. I know that it's kind of complicated to talk through the different ways that technology is interacting with us today in healthcare, but there's a lot of it coming. It's coming at a pretty quick pace. So it's good to know that the health systems and hospitals are really trying to integrate that and make it easier for patients like us to do a better job of understanding what our role is in there and how to interact better with it, right?
Sure.
Yeah, okay. Well, that's Pete for you, Dr. Peter Chang, SVP and Chief Transformation Officer at Tampa General Hospital. Thank you.
Thanks.
Don't go anywhere. Coming up next, talking more about AI in healthcare. Welcome back to Give It To Me Straight, Doc. I'm your host, Anjalee Khemlani. We have been talking a lot about AI today and its role in healthcare, where we've been seeing it crop up. And you've probably been using it, right, to your advantage, using ChatGPT, searching for things and the like. But what you don't know is that you can actually use it within the healthcare system. With me is CEO of CareYaya, Neil Shaw. Neil, actually, hey, Neil. Neil started off way before ChatGPT was a thing. Like before we even knew what AI was in sort of, popular culture, you already crafted a way to fight insurers using AI. Can you tell me a little bit about that? And just thinking about it actually in context of now that we do have these AI tools out there, how maybe are they able to accomplish the same thing now?
Yeah, great question, Anjalee, and thanks for the question. Basically, three things happened. One, I took care of my wife several years ago through cancer, and the hardest part of it was fighting all the medical bills and getting her the treatment she deserved because there were just so many battles with the insurance company. After that experience, I've been running a caregiving platform, CareYaya, that nationwide is helping over 50,000 families care for aging parents or spouses with serious illness. And I've realized thousands of people are fighting these health insurance battles. So I was just personally frustrated from my own experience, and then even more frustrated if all the families we're helping. So after that experience, I wrote a book on it. I just went down a rabbit hole of research, and I realized, why are all these people fighting these healthcare bills? And I realized health insurance companies have weaponized AI several years ago, and patients don't have any ways to fight back. So we built an AI system to help initially the family caregivers we're helping, and then it just totally blew up and went viral. And now we're just helping tens of thousands of patients around the country. And yeah, it's really empowering, to help people kind of get some agency back in this process. It's not rocket science. It's relatively straightforward, simple technology that learns and improves over time. We actually ended up getting it grant funded through University of Pennsylvania and the National Institutes of Health. So it's completely free for individuals to use. And yeah, I mean, we've won some massive cases, $50,000 cancer or tumor removal surgeries that have been overturned thanks to AI tools. So I think it's just like, to me, the fun part of it is democratizing access so that patients can have these tools at their disposal.
And that's been the theme of the day, right? Democratizing access. That's one of the key points about AI's role in healthcare is, are we finally going to get over the access hurdles? Are we going to be able to have AI doctors? Are we going to be able to diagnose using AI? Are the guardrails in place? Are we in a day and age where maybe, people aren't thinking so much about their privacy anymore? HIPAA rules existed for a reason. And there's been so much concern over the years with the use of technology, the potential for hacks, but people are just happy to use any of the online agents that are available, the AI agents, and put their issues in there, wait for a response, and take that to their doctor instead. And we saw that, the earlier version of that was Dr. Google, but now it seems like increasingly we don't have that problem anymore.
No, good question. And I think HIPAA is a good concern. I mean, people can use ChatGPT and Claude, for these purposes, but I do think you want to use a HIPAA compliant platform if you can get it. We built a HIPAA compliant platform that we realize people want their health data to be privately stored. So I think over time, it's any wave of innovation. The first wave of innovation happens and the tools are expensive. So in my hypothesis, in 2020, 2021, the insurance companies started using AI, but it's out of reach for more people. Then over the last year or two, ChatGPT, Claude comes around, and then everybody starts using it from a consumer standpoint. But then the specialized use cases aren't really there, or in niche, developed like the way we had. And then over time, those specialized use cases get known, and then everybody uses it for that purpose. So I'd say, if you're a patient out there and you're fighting a medical bill, I would still highly recommend use a HIPAA compliant platform like what we've built. But I sometimes just realize people are so desperate for fighting bills and getting the care they need that they would view it as using something is better than using nothing. So I
think that's where we are, right? I think that people just want to use something. They're so tired. They're so frustrated of not getting access to care. They're so frustrated that they can't get a doctor when they want it. And telehealth has been sort of in and out of reach, right? We saw it sort of fluctuate because of the pandemic. So we're just at a point, I don't know. I wonder if, we just no longer care about privacy of our healthcare like we once did as a society. And to that end, being able to use and lean on AI for answers. I know that another thing you're working on is for caregivers. You mentioned your own personal journey with that. I mean, do we see more opportunity to kind of relieve the burden, I think, on providers in this space then, if we have more and more people knowledgeable about how to use healthcare tools or how to look out for their loved ones using AI?
Yeah, 100%. I think that, the biggest benefit of AI is personalization, and personalization to help you through whatever you're going through. So on the caregiver side, so I'll tell you this, the couple of projects that we've built are, one, there's 10 million Americans taking care of a mom, dad, or spouse.
I'm one of them. Yep.
Right now. You're right. Exactly. So, and I've been there too. And, when you get put in this position, anyone that comes from outside the healthcare field, less than 11% of people say they receive any proper training. So can you imagine 9 million dementia caregivers are out there in society just winging it, figuring it out, what to do. So we built a tool, which we launched called the AI Guide, backed by an NIH grant, that personalizes caregiver training for you, understanding who you're taking care of, what prior skills you have, and then let's upskill you through short bite-sized videos and build your confidence so that you can feel less stressed, and also so that your loved one can get good help so you avoid ER visits and hospitalizations. That's something that has the power of personalization. And prior to AI, you would have had to sat there and go through 100 hours of a certified nurse aide course and pay $1,000 to get that type of training. Now you can do it, in 2-3 minutes a day while you're brushing your teeth and upskill gradually over the course of months. So that's kind of a pretty powerful, use case. Another is cancer care. So it was actually just in Tampa at Moffitt Cancer Center talking about this. 6 million Americans are caring for a loved one right now through cancer. Same thing. I was in this situation myself too. They don't teach you anything. You're just kind of on your own, and you're doing pretty complex medical tasks at home. And the consequences to something going wrong are very high. So how can we use AI and build AI to personalize the training for you so you don't have to go through 100 hours of curriculum And you can just take 2, 3, 5-minute bite-sized videos, take short quizzes, understand and upskill. The analogy I used in NIH grant, because I wrote the grant, was the Duolingo of caregiver training.
Love that.
I really want that. It's kind of funny, but it's like they've gotten the language learning down, to a science, using gamification techniques and AI and personalization. And I think that we're about to see a wave of that happen across healthcare, and these kind of like niche areas where there's just like significantly unmet need. And the unmet need is because there aren't doctors and nurses that can individually one-on-one train every family caregiver how to do dementia care for their father or how to do cancer care for their wife, but AI can.
And
notoriously,
it's in pocket
at all times.
Absolutely. And notoriously, if you don't know someone in the industry or don't have a connection, then you're just not going to be able to do a good job of navigating it. So this actually changes that dynamic altogether. We just have to see how well it's really used. Well, we'll have to leave it there, Neil. But, I'm so glad that you were able to join us and talk through this, because I think people need to understand that it's not as hopeless, right, as it once was when it comes to healthcare and navigating it, especially now with AI. So thank you so much, Neil, CEO of Care.ia. Thank you so much for joining us.
Thanks, Anjalee, for the opportunity.
A big thank you to Neil Shaw and all our other guests today. If you want to figure out how to fight your insurance with AI, you can log on to counterforcehealth.org. That's Neil's website to figure out that AI writing the reversal for claims and such. So don't forget to check that out. I've been your host, Anjalee Khemlani. You've been watching Give It To Me Straight Doc. Please tune in again next time.